Hello friends, once again welcome back to my YouTube channel. 1000 MCQs part 2 ആണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ വീഡിയോ എല്ലാവരും മുഴുവനായി കാണുക. And the first question, inventory control based on criticality of items is, the options are ABC, HML, VED and FSN. And the answer is VED. VED means vital, essential and desirable. Inventory control ഓരോന്നായിട്ട് നോക്കാം. First one is ABC. ABC based on value or cost. A is high cost, B is moderate cost and C is low cost. Next is HML and XYZ, that also based on value or cost. HML means high, medium, low, and XYZ is high value, moderate value and low value. The next is FSN. FSN is based on the consumption pattern, that is fast moving. F is fast moving, S is slow moving, N is non-moving. Next is Golf. Golf is based on availability and nature of the supplies. G is government supply, O is ordinary supply, L is local supply, F is foreign supply. And last one is SOS. SOS means seasonal and off-seasonal. This is all about inventory control. The next question, hormone having anti-inflammatory effect is, the options are estrogen, progesterone, corticosteroids and gonadotropins. And the answer is corticosteroids. And the next question, characteristic smile in tetanus patients is, the options are opisthotonus, ataxia, echinacea and rhizus sardonicus. And the answer is rhizus sardonicus because of highly characteristic abnormal sustained spasm of the facial muscles. The next question, primary sign of lung cancer. The options are cough, dyspnea, hemoptysis and chest pain. And the answer is cough. Primary sign of lung cancer is cough. The next question, smoking is a risk factor for all except, the options are lung cancer, bladder cancer, pancreatic cancer and laryngeal cancer. And the answer is pancreatic cancer. Remaining lungs, bladder and laryngeal cancer nellam risk factor smoking aanu. The next question, first artificially made vitamin is, the options are vitamin A, vitamin D, vitamin E and vitamin C. And the answer is vitamin C. Vitamin C discover ചെയ്യുന്നത് 1912 isolate ചെയ്യുന്നത് 1928 and chemically produce ചെയ്യുന്നത് 1933. The next question, no resistance against gravity in Bishop score means, the options are score 5, score 4, score 3 and score 2. And the answer is score 3. Bishop score detail ആയിട്ട് നോക്കാം. Bishop score used to assess motor function. The score 5 means maximum resistance against gravity. Score 4 means minimum resistance against gravity. 3 is no resistance against gravity. 2 is along the gravity. 1 means muscle twitching. 0 means no response. The next question, normal cerebrospinal fluid pressure is, the options are 5 to 15 mm of Hg, 8 to 18 mm of Hg, 15 to 30 mm of Hg and 80 to 180 mm of Hg. And the answer is 5 to 15 mm of Hg. CSF pressure 3 തരത്തിൽ പറയാം, that is 5 to 15 mm of Hg ആണ്, 8 to 18 cm of water ആണ്, 80 to 180 mm of water ആണ്. The next question, study of drug dosage is, the options are pharmacognosy, toxicology, posology and none of the above. And the answer is posology. The next question, abnormal susceptibility to an agent peculiar to an individual is, the options are toxicity, drug reaction, adverse effect and idiosyncrasy. And the answer is idiosyncrasy. Example പറയുകയാണെങ്കിൽ എയറിന് വരെ അലർജി ഉള്ള സം പേഷ്യൻസ് ഉണ്ട്. The next question, sexual arousal as a result of obscene phone call is termed as coprophilia, scatologia, biastophilia, none of the above. And the answer is scatologia is otherwise called as coprolalia, means use of obscene language. Coprophilia means abnormal interest and pleasure in the feces and defecation. Biastophilia means sexual arousal and excitement based on surprising or attacking a stranger sexually. The next question, first nurse researcher is, the options are Edward Deming, Donna Bedian, Florence Nightingale, and Henry Fayol. And the answer is Florence Nightingale. First nurse researcher and first nurse theorist to Florence Nightingale ആണ്. The next question, first choice of antihypertensive medication at pregnancy is, the options are Methyldopa, labetalol, nifedipine, and hydralazine. And the answer is Methyldopa, 250 mg to 1 gram per oral or 250 to 500 mg intravenous ആണ് Methyldopa അഡ്മിനിസ്റ്റർ ചെയ്യുന്നത്. സെക്കൻഡ് ചോയ്സ് ഈസ് nifedipine. AC inhibitors second and third trimester contraindicated ആണ് because increased risk of fetal renal damage. And labetalol hypertensive ക്രൈസിസിന് കൊടുക്കുന്ന മെഡിസിൻ ആണ്. നൈട്രോഗ്ലിസറിനും യൂസ്ഡ് ഇൻ hypertensive crisis. The next question, first case identified by the health worker or epidemiologist is, the options are primary case, secondary case, index case, and first case. And the answer is index case. Primary case എന്താണെന്ന് നോക്കാം. Primary case is first case of a particular disease in a community. Next is secondary case. Secondary case is those case which are developed from contact with the primary case. Primary case ന്റെ കോണ്ടാക്ട് മൂലം ഉണ്ടാകുന്ന ഫസ്റ്റ് കേസാണ് സെക്കൻഡറി കേസ്. The next question, time interval between primary case and secondary case is, the options are incubation period, extrinsic incubation period, serial interval, and generation time. And the answer is serial interval. Generation time എന്താണെന്ന് നോക്കാം. Generation time is time interval in which the host become maximum infective. The next question, the most effective teaching method in stimulating cognitive domain is, the options are discussion, demonstration, teaching books, and self-instructional. And the answer is demonstration. The next question, statement of research problem should have all except, the options are variable, research design, population, and hypothesis. And the answer is research design. The next question, the ultimate purpose of all nursing research is to, the options are stimulate more research in nursing, improve care of patients, broaden one's knowledge base, discover explanation to theories. And the answer is improve care of patients. The next question, those restrictions that the nurse researcher place on the study before gathering data are called, the options are assumptions, statistics, limitation, and delimitation. And the answer is delimitation. The next question, which of the following activities would be most appropriate for a client who has bipolar disorder with aggressive social behavior? The options are badminton, writing, gardening, and chess. And the answer is badminton. അപ്പോൾ ഇത്രയാണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ തേർഡ് പാർട്ടുമായിട്ട് അടുത്ത ദിവസം കാണാം. താങ്ക് യു ഫോർ വാച്ചിങ് ഗൈസ്. Please like, share and subscribe my channel. Thank you.